Hi, I'm going to go over the back valve mask ventilation for apneic adult patients procedures. First, I'm going to make sure I take PPE precautions and I check if my scene is safe. And then I'm going to check my patient's responsiveness. Then I'm going to request for EMS backup. And then I'm going to check their breathing and pulse. The proctor's going to tell me that they're unresponsive, apneic, and they have a weak pulse of 60. Then I'm going to open my patient's airway, and then the proctor is going to tell me that their airway is full of secretions and vomitus. Then I'm going to prepare their rigid suction catheter, and then I'm going to turn it on. Then I'm going to insert the catheter without suction. Then I'm going to suction the patient's mouth and oral pharynx. Then the proctor is going to tell me that their mouth and oral pharynx is clear. And then I'm going to insert the oropharyngeal airway. And then the proctor is going to tell me that the patient has no gag reflex and they accept the airway adjunct. And then I'm going to touch the back valve mask with ventilated patient without oxygen. The proctor is going to tell me that ventilation is a success. Then I'm going to check the pulse, and then I'm going to attach the back valve mask to oxygen and ventilate the patient at 15 liters per minute. And then I'm going to check for chest rise, and I'm going to give them one ventilation for every 5 to 6 seconds. And those are the procedures for back valve mask ventilation for apneic adult patients.